welcome to TapRooT TV. I'm Michelle Wishon, and today our guest is Chris Valley. Welcome, Chris.
Hi.
Today we are going to talk about a topic that I believe we can all relate to. I know that I can, and I definitely know that Chris can, in both our personal and our business lives. Chris is going to talk to us about a blog article he wrote that's very near and dear to him. When a patient's heart stopped twice in the emergency room, what was missed? Chris, you want to talk to us a little bit about that?
Yeah. So a lot of times in our live feeds and from TapRooT System Improvements, we talk about tips you can do and things you can learn. But underlying all that is the reason why we do what we do in TapRooT. We want to prevent things. We want to learn things. We don't want to blame people. But then sometimes we lose track that there's an emotional concept behind the whole reason why we're doing the investigation and how people feel after an incident. So this is a case that's near and dear, and I'll explain why at the end, is our mind has a tendency to form patterns. And we can have something right in front of us. Man, it sounds like we have a flat tire, but it must not be a flat tire.
Right.
My low light's on, but not. It's something else. So we
or
have
your engine light. Your engine light in your car.
Oh, that thing you tap,
That'd be
and
fine.
it goes away.
Yeah.
But you see something right in front of you, and the symptoms are there, but your mind says it's just fine. It either thinks it's fine or it wants to think it's fine, and that affects our decision and our responses. Well, I knew that the child was making bad grades, but I just figured it was just a temporary thing. I didn't realize there was something bigger going on.
Sure.
And then after the incident, all over the news, big incidents or things at home, you hear, man, I saw this coming the whole time. I didn't realize it was as bad as it was.
Right.
So it's all right there, but our mind plays tricks.
Right.
So this deals with the symptoms of fatigue and weakness, rapid heart rate, shortness of breath, reduced ability to exercise, persistent cough and wheezing with white or pink blood tinged phlegm, swelling in your legs, ankles, and feet, lack of appetite and nausea, difficulty concentrating and decreased alertness. Now, of course, if you looked up those symptoms on the internet, you probably think you have every one of them.
Right.
But when a doctor or a nurse or a physician, PA, whatever, sees these symptoms, these all in a whole mean something's going on. These are actually symptoms for congestive heart failure.
Yes.
So a particular patient had a resting heart rate of 122 beats per minute.
Wow.
And that's 5 days after the birth of a child. And so basically the patient went into an acute care. They did some x-rays, and they said, a technician actually said, I think I see fluid behind, in the lungs.
Sure.
And the doctor reviewed it and said, nah, that's nothing. The person's breastfeeding, there's going to be some fluid, they just had a baby. And they gave them medicine to slow the heart rate down. Now, the patient goes home, takes the medicine, slows the heart rate down, and all the symptoms I just described below get worse. The patient self-diagnoses herself that she's drowning, that she feels like she's drowning. She calls 911. The ambulance shows up, and they look at her, and they do some tests. They don't read the oxygen level. They do some tests, and then they clean her up, and they drop her off at the front desk. Now, there's a husband involved in this. Before she went to the hospital, the husband was, well, the doctor said you're fine. We're going to go see the real doctor in the morning. You're just fine.
Yeah, sure.
Yeah. Luckily,
you're already in the ER, doctor, yeah.
Yeah. So luckily, the wife didn't listen to the husband. So then the husband has a 5-day-year-old and trying to figure out what to do with the 5-day-year-old, has 2 teenagers, and they drop this the spouse off at the front desk who's having heart failure, mind you, and they're asking her insurance questions. Well, she finally can't force herself to breathe, and they take her to the back and paralyze her so they can evaluate her, which actually made the conditions worse. By the time they realized she was having heart failure, she arrested twice. The ER was going through construction and couldn't find a defibrillator.
Oh, my
So
goodness.
she arrested twice.
Yeah.
The spouse finally gets up there. Luckily, a very wonderful specialist heart doctor shows up. realizes what's going on, treats her properly, kind of doctor that can put your hand on a patient's chest to know what the equipment's going to tell you what the ejection force is, how much it's pushing out.
Right.
So what does this have to do with today? What does this have to do with TapRooT? Well, in investigations we do, whether you don't troubleshoot a piece of equipment properly, whether you don't troubleshoot a patient properly, and all the symptoms are right there, but you either ignored them, you thought they weren't important, you thought it was something else. They're all there. And normally, in many cases, you think, well, this must have been something different. That something must have changed. This was a different symptom. There was a change in the process, a change in the training. And there must be some reason why they didn't see this thing that was out right in their face.
Right.
There was no change. All of these symptoms were heart failure.
Right.
There was no change in the policy. There was no change in training. There was no change in the equipment they used. They just didn't read her oxygen rate.
Right.
And so you go, why? Because she was 35 years old, and 35-year-olds aren't having heart failure. People that have heart failure are laying on the ground or in a bed, can't get up.
Sure.
And her will to survive and her ability to force the fluid out so long. They just let the outlier 35-year-olds don't have heart failure. So now, why is this personal? Because this was my wife when my 14-year-old, soon to be 15, was born. And I was the one who said, you're fine. Luckily, she didn't listen to me. I was the one who had a 5-day-old with you, and they say, your wife's either going to have brain damage or need a new heart. Now, she spent a lot of time in recovery. So what do you learn from this?
Yeah.
Well, you learned that a 22-year-old had died the week before in the same hospital.
Oh, my goodness.
You learn that this wasn't something new, some rare disease. Every one of the symptoms were there. So when there's a protocol, and it's not about blame. These aren't people that want anybody to die. These are people who make very quick decisions in what I call triage. They make triage decisions to stabilize something with a best guess. Now, best guess means you're either going to get it right or you're not going to get it right.
Yeah.
But if you depend on triage, when a protocol of if you see this or this or this should be followed, you collect all the evidence up front before you make a decision, that standard protocol should always be followed. And then if you can't figure out what's going on or the symptoms don't match as a whole, then you really depend on your past experience and your best guess. So in TapRooT, we teach you to proactively go map and look for these hazards. Look for these areas where you make a decision based on a best guess when you shouldn't.
Right.
Because the difference is, okay, I should have changed the pump and I didn't. Is that just a simple thing? Is it I should have gave you an antibiotic because you really had, it wasn't a virus, it was an infection? Or does somebody die, or do you have non-production time because you used a best guess when you had everything you needed in front of you? So that relates to what we teach every day. That also gives you meaning to why I enjoy what I do. I work with a lot of hospitals. And everything you do, you have to control. You have to control a hazard. You have to control a specification. You have to control a need. And there may be things you do that create the problem initially, but there's also plenty of chances to catch it. TapRooT is also about all the chances you had to catch it once the bad things started happening, where many root cause processes are about what caused it. Now, how many people did my wife's congestive heart failure pass through? We're talking about nurses. We're talking about a acute care doctor in clinic and a technician. It's also about what we call crew resource management. When the technician said, hey, raised their hand and said, I think something is wrong. And the person who had the overall decision goes, nah, it's fine. So when you truly feel that something needs to be looked at, that's part of what we call crew resource management TapRooT. When you see something, whether you're correct or not, if it looks like it might be bad, stop and follow a protocol so you're not letting your mind play tricks on you. You're not letting your mind make decisions on a best guess. When you really, after the fact, had all of this in front of you, all these symptoms were there when you looked at them as a whole. But you let one thing, that was a 35-year-old, you let the age drive whether you should do anything deeper.
So tell us again, Chris, the ER doctor, when she initially went in the first time, what did he say and then send her home?
Right. So that initially it was an acute care doctor at the doctor's office.
Okay.
And they said, okay, well, we measured your heart rate. Yeah, that shouldn't happen. You just had a baby. Okay, so your body might be tired. We'll do an X-ray and see if we see anything.
Mm-hmm.
And it was like, even though the technician was bringing up something, they could have said, well, you're probably breastfeeding, right?
Mm-hmm.
And she would have told them, no, I've been trying to breastfeed and I can't because all our fluid was going somewhere else. It wasn't up here.
Right.
Except it was in the lungs.
Mm-hmm.
So he didn't ask that next question to verify. He basically said, here's some medicine.
Mm-hmm.
Go to your doctor in the morning.
Mm.
So triage, try to control it. We don't want your heart to wear out, which it was already wearing out.
Yeah.
Because she had high blood pressure.
Yeah.
And just sent her home.
It's so scary. It happens so many times at your workplace, in your personal life, and it happens quickly.
Yeah.
And in this case, it could have been fatal. So I'm so happy that Babette does not listen to you.
Yep. Thanks. She'll like that.
Well, if you would like to read more about Chris's blog, visit our website at TapRooT.com and click on blogs. To read. You can read more on his blog. We have wonderful blogs post that goes out every day. So,
and if they want to look for this one specifically, so we've just changed our website. So when you pull up blog, there's things you can filter by topics.
mm-hmm.
But to find something specifically, if you go up to the top of the website, there's going to be a magnifying glass.
Right.
If you type in heart stopped or root cause analysis tips, patient heart stopped twice. So if you type in congestive heart failure or heart stopped, that will bring up the article. So it uses a text search. Yeah. So it's at the very top at the magnifying glass.
Yeah, it's really easy to find that way. We have wonderful blog articles every day, like I said. For more information, you can send us an email at info@taproot.com. And as always, you can call us 865-539-2139. And
I'd like to close with one more hint.
Yeah.
And the hint is there's a time for triage.
Yeah.
That is when you have to control the situation immediately. You have to stop the bleeding. Mm-hmm. You have to stop the fuel leak from going into the river. Whatever it is, you have to stop the overheating issue. If you truly don't have time to truly assess it, then yes, triage is the answer. Having the right expert making the best guess based on what they see is the right answer. But when you truly have time to assess it correctly, to get the right symptoms, and you can take that extra step to truly collect the evidence and follow the established protocols, triage is not the answer at that point.
Mm-hmm.
Only when you have no time to respond and you have to act now and do something.
Yeah.
Triage is not the answer when you have the time.
Right.
It's not the answer when you do root cause analysis either, because you don't have to make a best guess. You have time to then go collect the evidence.
Mm-hmm.
So don't make triage be the go-to.
Yeah. It's really important to pay attention and go slowly when you're doing this stuff, and pay attention to what the patient's saying. I mean, this could have very well been a misunderstanding in verbal communication. It's the fact that, like you said, she's 35 years old. This is not happening to her. There's just so many factors and issues there. It's really scary. So, well, we will see you next Wednesday at noon Eastern. Have a safe week. Thanks.
Thank you.